Hello everyone, I am Dr. Prachi Kulkarni, Fertility Specialist, Ferty9 Fertility Center. Today I am going to talk about PGT, that is Preimplantation Genetic Testing. So what is Preimplantation Genetic Testing? Why are we advising some patients to undergo a Preimplantation Genetic Testing? What are different types of PGT and which patients will benefit with this PGT? So what is PGT? PGT, the full form is Preimplantation Genetic Testing. This is done on an embryo, which is a blastocyst grade embryo. So I have a picture here. This is a day 5 or day 6 blastocyst grade embryo. So this embryo has an outer layer of cells, which we call as stroph ectoderm. So these stroph ectoderm cells form placenta and membranes. There is an inner cell mass which forms baby, which forms the body of the baby. So what we do is, once we have an IVF cycle, at the end of IVF cycle, when we have day 5 or day 6 good grade blastocyst, we do a biopsy of few of the cells from the outer layer, which is stroph ectoderm. So what embryologist does is, before freezing the embryo is given laser shots so that there is an opening made in the zona. So the cells can be loosened and taken out from outer layer, and few of these cells, like 7 to 8 cells from the outer layer, can be picked up and sent for biopsy. So after completing this biopsy, taking out the cells, embryo is frozen. This biopsy is also frozen, and this frozen biopsy is then sent to a center which does the genetic analysis. So the genetic analysis is done by different ways. So what are the different techniques of PGT? So the most commonly used technique of PGT is PGT-A, which is Preimplantation Genetic Testing for Aneuploidy. And second one is PGT-M, which is Preimplantation Genetic Testing for Monogenic disorders. Third one is PGT-SR, which is Preimplantation Genetic Testing for structural rearrangements. So these are 3 techniques of PGT: PGT-A, PGT-M and PGT-SR. Why are we doing PGT? To analyze the embryo genetically. So coming to the first one, which is PGT-A. PGT-A is to check for aneuploidy. So what is aneuploidy? Aneuploidy means the set of chromosomes which are present in the cell. The number of chromosomes is either more or less. So normal number of chromosomes is called as euploid. Eu means normal. Aneuploid is anything which is less or more. So what is euploid number for human cells? It is 46. So the embryo which has 46 number of chromosomes is euploid, which means normal. And in PGT-A, we select a euploid embryo for embryo transfer. So PGT-A will also tell me if your embryo has a number of chromosomes more or less. So usually these are either in the multiples of 3 or there might be less numbers. So when they are in the multiples of 3, it's called trisomy. When the number is less, then it is called monosomy, because 2 is the normal number. So 1 is monosomy, 3 is trisomy. So most common conditions which may lead to miscarriages or which may lead to IVF failure related to the chromosome numbers are these trisomies and monosomies, like monosomy X or Turner syndrome, trisomy 21, which is Down syndrome, trisomy 18, which is Edwards syndrome, trisomy 16, Patau syndrome. So there are different genetic syndromes. So if I find any embryo which is having these trisomies or monosomies, we don't select that embryo for embryo transfer, because they will either end up with miscarriage or implantation failure. So this is about PGT-A. So now which patients we advise to undergo PGT-A? So as I mentioned, the number of chromosomes, if it is more or less, they might end up with miscarriages. So we advise this for patients who have had history of repeated miscarriages. Also, we advise it for patients in which in the couple where the woman's age is more than 35 years. So as the age of the woman increases beyond 35, the chromosomes are sticky. They do not separate out completely, and this leads to these kinds of aneuploidies. So what happens is, older women will have more miscarriages even in IVF or even when they naturally conceive. So to reduce the time to pregnancy, or to avoid these miscarriages because of aneuploidy, we advise to undergo PGT-A and we select a euploid embryo for transfer so as to reduce their risk of miscarriage. So for women who are having recurrent miscarriages, for women who are more than 35 years of age, and also for the patients who have had history of recurrent IVF failures or repeated implantation failures. So one of the cause which is associated with implantation failure is having abnormal number of chromosomes in the embryo. So if an embryo is having a normal set of chromosomes, which is the euploid embryo, the chances of implantations improve. So these are the three conditions where we advise to undergo for, a PGT-A on the embryos. So now coming to the second form of PGT, which is PGT-M, pre-implantation genetic testing for monogenic disorders. Mono means single, monogenic disorders means genetic disorders which are occurring because of a single gene problem. So these disorders can be thalassemia, cystic fibrosis, or other metabolic diseases where single gene is affected. So where do we advise to undergo this is the patients who have already had a child with a particular genetic condition and the parents are the carrier of that particular genetic condition, we advise to undergo PGT-M. Or also the patients who are married in relation, like consanguineous marriage, married their brother or sister or their cousins and having recurrent miscarriages, those patients we may advise to undergo whole exome sequencing or extended carrier screening test, which is the genetic test of the parents. If both of them are carrier of certain autosomal recessive condition, which is happening because of single gene, then we may advise them to undergo a PGT-M on the embryo. So the process is entirely same, doing an IVF cycle, having a blastocyst stage embryo and doing the embryo biopsy, freezing the embryo and sending it for testing. But in PGT-M, we have to do pre-PGT-M workup. So which includes the couple's blood test or the affected child's blood test to exactly make the templates for the testing on the embryos. So this is called as pre-PGT-M workup. So this includes the blood test of the couple and the affected family member or affected child, and then looking for the same gene or the template on the biopsied embryo. So this is about the PGT-M. So this is advice to the couple where they already have a child which is affected with a genetic condition which is caused by a single gene, or if they are married into relation and they have had repeated miscarriages and they are found to be carriers of autosomal recessive condition for a particular genetic disease. So this is about PGT-M. Now coming to PGT-SR. PGT-SR is pre-implantation genetic testing for structural rearrangement. So structural rearrangement means the structure of a chromosome is such that there is a short arm and there is a long arm, and there are different genes which are coded on that chromosome. Sometimes what may happen is a segment of the chromosome gets reversed and attached at a different site. So for that particular patient, genetic material is complete and balanced. So this is called as balanced translocation. But when these chromosomes are separating and going into the gametes, the separation may happen in a way that because of this balanced translocation, they may go in an unbalanced state. So some are having different genetic material than expected. So how do we detect that? First, we do karyotype test of the couple to find out if they are carrier of a balanced translocation. So sometimes Down syndrome, when we see there might be this kind of occurrence which may happen, that either of the couple are, especially the women, they are the carrier of the Down syndrome because of the balanced translocation. So what happens is, if that goes in an imbalanced state, then the affected child again will be having the Down syndrome, or they may have miscarriages. So we do couple karyotype first, and if we find if there is any balanced translocation, we advise them to undergo an IVF cycle with PGT-SR so that we can select an embryo which is normal and not having the translocation. So this is about PGT-SR. So PGT-SR is advised to the couples who are carriers of a balanced translocation themselves, and sometimes also to couple who have had miscarriages. And when we do a karyotype, we accidentally find that one of them is carrier of a translocation which is balanced. So this is about the PGT. So I hope this was helpful. So especially these techniques are advanced techniques, and they are still sometimes are not freely available, but they are available with the good IVF centers. And this genetic testing will definitely help couples who are struggling with the issues of recurrent miscarriages or issues of recurrent implantation failure, or struggling to have a genetically normal child, especially in a consanguineous marriages. Thank you so much.